Can a facelift improve crow's feet? I am aware there are many techniques, surgical and non-surgical, that can reduce the appearance of crow's feet. Having said that, I would like to know if a facelift, with its repositioning of muscle and skin, can diminish crow's feet. Many thanks.
Thank you for your question. You were asking if crow's feet lines can be treated with a facelift. And I certainly understand why you're asking this question. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. My expertise is in facial aging as well as advanced treatment of the area around the eyes. And I've been in practice for over 20 years in Manhattan and Long Island. As far as the question about crow's feet lines is concerned, there is invariably the natural instinct to just pull and say, well, doctor, can you just pull and tighten this? And the problem is that crow's feet lines is really a combination of factors depending on on two key elements. One is the activity of the muscles around the eye responsible for the contraction of the skin and the looseness or laxity of the skin around the eyes. So first, let's just start with the assumption that the skin is not that lax around the eyes and there isn't eyebrow ptosis. What is causing the crow's feet lines is the muscle called the obicularis oculi muscle. Now this muscle contracts, and when it contracts, it causes these lines to form. So the traditional approach to this is a drug called Botox, as well as the comparable drugs Dysport and Xeomin. Basically, you're stopping the muscle from contracting, and by doing that, the crow's feet lines improve. In addition to that, if you have static lines, which it's not unusual, then it's typical for us to also do a treatment with a laser, such as a fractional CO2 laser or erbium laser, to resurface the skin as well as tighten the dermis to improve the quality of the skin and improve the appearance of the crow's feet lines. Now, there are times when a person has eyebrow ptosis where the brow can be lifted and you can actually reduce some of the skin that has descended and is contributing to the depth of those lines. Interestingly, prior to the advent of these injectables and lasers, there are procedures in our medical literature about actually cutting out this muscle to help reduce the appearance of the crow's feet lines. But I think most of my colleagues would not pursue that method given the technology and methods that we have. Crow's feet lines really are, because of the multiple factors that contribute to them, a facelift in itself doesn't really directly address this area. In fact, a facelift really addresses the descending cheek and jowls. So when you think about it, when you're lifting the face, you're actually moving in a direction that doesn't affect directly the crow's feet lines. Now, if you make the incisions go up high into the hairline, you can somewhat improve the appearance, but still the skin vector will not be enough to really flatten that area. You can get some improvement, but as I said, it's more about the upper part of the face that can affect the appearance of the crow's feet lines. But in the end, it would be, I would recommend or I would describe what we would typically do in our practice. If someone is concerned about the lines around their eyes, we would do some type of combination of Botox and resurfacing, as well as the use of platelet-rich plasma, which can help improve the skin quality and synergize with the benefit of the laser procedure. So again, understanding that a facelift really is about the mid to lower face, and that lift would not directly affect the appearance of crow's feet lines. and that the procedure, a surgical procedure like a lateral or temporal brow lift, can indirectly improve any redundant skin or any skin that has descended that's contributing to the crow's feet lines. But in the core principle of the activity of this area and this compartment or a section of the face, you're dealing with a muscle called the obicularis muscle that can be treated with Botox, and you're dealing with skin quality, which can be improved with a combination of laser as well as platelet-rich plasma. So I hope that was helpful. I wish you the best of luck, and thank you for your question.